Thinking about rapidly evolving digital environment? Wondering if eyeballing all these electronic devices making us blind? Pause, think about it with intentional thought, and consider where we go from here. Stay tuned and hear what Dr. Ebbie Jackson got to say about eyeballing for greatness and not just being what the cool thing is to do.
Something to think about with Dale Happy Knowles.
Welcome to Something to Think About with Dale Happy Knowles. What we think, we become. What we radiate, we attract. And what we imagine, we can achieve. Let's change the narrative 242. So join us today, our sponsors, Domdev Enterprises and Paget Investments, and our friends of Something to Think About as we discuss some enlightening things today with Dr. Ebbie Jackson. Welcome, Doc.
Good evening, Dale, and thank you for having me.
Great,
welcome,
awesome.
And good evening, Bahamas, and to the wider world.
Yes, and we stand a little bit across the globe, hopping and skipping and jumping, and hopefully we'll be far reaching in due course. So you're an East Street Gospel Chapel girl, the child of God, a wife, an optometrist, a president, a teacher, a musician, a marathon runner, author, Bible trainer, and a 12-year breast cancer survivor. How you fit all that in?
That's a good question. Sometimes I wonder myself, but I tell people I think the Lord has blessed me greatly. So to whom much is given, much is required. Therefore, I have to do what I have to do. I got to maximize my time. And so I stay busy. And I'm enjoying it.
Good. And you actually still actively involved in helping people with the women in particular in cancer. And this is actually Breast Cancer Month, right?
Yes, it is. October is celebrated as Breast Cancer Month worldwide. And so many women are being diagnosed, not just here in the Bahamas, but around the world. So we have to continue to keep it in the forefront and to encourage women to make sure and have their mammograms done, to do their testing, self-checks on a regular basis. And if you see strange things happening with your body or feel strange things, please go ahead and follow it up. Yeah.
Cool.
But it'll always be with us, and we just have to continue the journey. And the thing about it is that as technology improves, it's truly helping healthcare, and women are living longer, successful lives as a result of newer treatment options.
Yes, that's great. That's great because technology is really moving rapidly. Because some of the things that I heard some people tell me about prostate cancer and how they used to treat it earlier or diagnose it earlier, and now the technologies that they use is so much less. I don't know, abrasive, let me use that word, than before, and so forth. So that's great.
Because treatment options before, which is cut, do this and that, and now robotics is it's being used for surgeries. The type of cancer drugs are delivering right to the spot now, as opposed to having to take the chemotherapy through IV injection or through a port. Right. And so, yes, technology is really revolutionizing the world and changing the way we live, what we do, how we practice.
Cool. Now, I'm an elite athlete myself. I don't believe that. But just to keep up with that heavy load that I called off just now, and more than what I called off, kind of make me tired, right? So what fuels that attitude that allows you to conquer that load that you feel on your heart that you have to do every day?
I won't say I'm doing everything, but I'm doing the things I love to do. But I love to help people, and then I always love to push myself beyond what I think I'm capable of doing. So I guess that's that inner drive within that helps me to just say, hey, why don't try this, or why don't you do this? And I always feel that I could do it, so I do it. And then too, I just think I've been blessed to be able to manage 10 or 20 things at the same time. I'm doing 10 or 20 things all at the same time, and keeping them in balance, and having them completed. So I am maximizing myself. I tell them when I go to the grave, I would have worn myself out and done all the exciting things I want to do. And then I've traveled the world. I travel quite a bit, because I love to see how people live, what they do. And then when I'm moving about, what I see and do, I'm saying, well, how could we do this here in my country? Or how could we do this differently? That sort of thing. So, but that's just how I'm wired. I tell people that's how the Lord made me.
Yes, yeah. So is it a balance, or because you're a fit lady, running marathons, man, Christ, I can't run no marathon. I struggle to get around the corner. But I mean, I could do other things along, but not run. I just get a mental block. But is it the physical, the mental, and the spiritual together that allows you to achieve these things, or how important are those things to achieve what you achieve?
They are very important. But from a child, when I remembered my mom saying to me around age 5,
Mm-hmm.
she said, you started talking at 1. And she said, I said to my husband, my dad, and father, she said, this girl is going to really do things, because she could sense even that, from the time I was born and how forward I was and what I was doing, that, hey, this girl is, it's beyond her years.
Right.
So I just think it's the gifting and what I've been endowed with. However, yes, my relationship with God is priority. And I said, I want to live the best and do the best for him. And so I pursue the other things, and physical fitness has always been a part of my life. I was always active in sports in high school, and even beyond that, and teaching aerobics and doing that. But once I found the sport of marathon running, that was another level that allowed me to be able to maintain my fitness and to accomplish greater things. Because yes, when you run 26.2 miles, believe me, you are in a different category. And it's a major accomplishment. And while you're doing it, you wonder why you're doing it. And then when it's over, you're like, okay, what's the next one?
What next? Next mountain to conquer. Yeah. So you chose to go into the eye care industry. And my understanding is there are 3 main types of doctors or professional care persons. You want to highlight those
related to the eye?
Yes,
okay,
because
you have ophthalmology. They're the eye surgeons. You have optometrists, primary care eye persons. And then you have opticians. These are the ones who really make glasses, but now some of them are able to prescribe glasses and prescribe contact lenses. However, I'm an optometrist. We are the primary care ones. We're allowed here in the Bahamas to treat medically. So if persons have dry eyes, if persons have glaucoma, we manage persons with diabetes, hypertension, and all those things that relate to the eye. And if we feel that the person needs to be referred for surgery or for further management, then we refer to the ophthalmologist. So a lot of times persons would say, they're not real eye doctors, or do they do this and that? No, here in the Bahamas, the eye doctors are very trained, qualified, and able to treat and manage certain eye diseases. And we work in hand with ophthalmology. And the thing about optometry, though, in America, you have optometrists who are working in surgical centers, who are managing patients. Optometry is expanding so much around the world in terms of what we're being trained to do and capable of doing. And of course, we're trained to use medical drugs, with certain conditions. So I think Bahamians need to be a bit more educated and enlightened concerning that. Now, an optician is one who makes glasses. Some of them are able to prescribe glasses and to prescribe contact lenses. And when it comes to contact lenses, definitely that's the field of optometry,
Okay.
specialty lenses and regular contact lenses.
Yes. And so we want to talk about eyeballing for greatness, how we can cause people to be as great as they can be, a society and nation as a whole. And so why is it important then for people to go to, I wouldn't say the right doctor, but the appropriate doctor. Let's say the appropriate doctor.
Okay, I've been practicing home about 30 years. I have seen eye care really develop and expand in our country, and it is a result of the optometrists that returned home to the Bahamas.
Okay.
Previously, we were under the British licensure, okay? And we were limited in terms of what we were able to do. Now, most of us who are trained either in North America or Canada. And, you know, in North America and in Canada in particular, professions expanding by leaps and bounds, okay? So most of us here are trained and medically trained also. So when we returned home, we as an association formalized and we decided, hey, we needed to improve our laws and to be able to allow us to expand and to be able to manage patients in the area in which we are able to manage them and treat. We don't go beyond our scope. We work within our scope. And so people need to recognize that. Now, of course, there can be challenges with ophthalmology because, you know, sometimes they feel, well, we are entering into their sphere. But the key is, and in all healthcare professions, because I think we need to recognize it, we are sending our children off abroad to study. They're being trained in different arenas, and they're highly qualified and trained. So when you return home to your country and you being limited in terms of your field or scope of practice, it's really a detriment to the development of your society. I think persons need to be allowed to be trained and to be able to work in the scope of their training. So for us as optometrists, we're fortunate and blessed that, yes, we were able to get laws and policies in place that would allow us to practice within our scope. So we do have trained, qualified eye care professionals here. And we work hand in hand with ophthalmology because you could only fight for so long. We all need each other. Right. And also, unfortunately, here in our town now, it is so difficult, Dale, to get an eye appointment. Why? Because most of us are over 50, even though I look younger. But most of us are over 50.
25, yeah.
I'm telling you, and not even 25, eh? But most of us are over 50. Some of us are retiring. There are other related problems. So now it's hard to get an eye appointment because you only have a few eye doctors who are really working. Now think about it. Most of us are in Nassau. The rest of the family islands are not even covered. Okay?
Yeah.
Now you have one or two who go to one or two islands, but the majority of islands are not covered. Eye care is becoming so popular and so prevalent now that it's hard for persons to be able to get an eye appointment. Therefore, and one of the other major obstacles is the fact that no one is studying or training to return home to the Bahamas to practice, or to replace them. So I'm constantly trying to encourage persons, listen, in particular women. You know, everybody wants to go into general medicine. We have more doctors than we can shake a stick at. But persons don't realize, you know, who got me involved in optometry? I myself, back in those days, because back then you either became a doctor, lawyer, Indian chief when we left high school.
Okay.
And I was on the path to go into medicine. You know, I always said I wanted to be the pediatrician or gynecologist. And after I left high school and college, came home because I was burnt out from studies. My mom returned home one day from the eye doctor. And she said, hey, why don't you become an eye doctor? That looks like a good profession for a woman. And at that time, I didn't even know what an eye doctor was or what an eye doctor did, because you only knew of general medicine and certain specialties. So I started doing my research and I said, wow, this looks like something I may be interested in. At that point, wasn't sure if I wanted to go to school for another. I would have had to finish medicine, and then you'd have to go on to specialty, which was another 2 to 4 years back in that
Right.
at that time.
Mm-hmm.
So, and then I wasn't sure if I wanted to be on call anymore. And I said, if I want to get married, I need to consider my profession because now I'm getting older. By the time I finish your childbearing years, all these things I'm going to consider. So after doing my research, and I realized, wow, this looks like an interesting profession. I met a Bahamian who at the time, and he's still practicing in the US. A friend of mine knew him, connected us, and he told me about it. And I said, wow, this is something that may interest me. Applied, got into a program and started, and never looked back one day ever.
Right.
You know?
Awesome. So in the Bahamas, then, you all are able to spread your wings and really fly and be creative. When I say creative, not experiment on people, but use the tools that they train you to use. It's because I know some places and some things people are not able to do that in the Bahamas. In some disciplines or some professions, it feels like people are being strangled, held back, or the like. So in your profession, that is one. It's sounding like you're saying that you have a shortage of professionals for one, and it's going to get even shorter if we don't have a backfill. And this is a very opportune time for people to get into it, and because it's also something that is mentally stimulating, for lack of a better term, to do. Is that correct?
Yes, to a point. As I said previously, our students now are going off to study and being exposed to so many different health careers and pathways. Back here in the Bahamas, we were so and always just used to certain professions.
Right.
And then, of course, the persons who are leading these professions, they're still trying to micromanage these professions. So think about it. If you send your son or daughter off to be trained and they become, think of audiology now. When we thought of an audiologist back then, even nursing, which is a big thing, you now have nurse practitioners. You have nurses in the US who are managing clinics and practicing at their full scope, whatever their training involves. When the person comes back home to the Bahamas, we don't even have the policies in place to accommodate these people. Okay?
Right.
So therefore, they feel frustrated because legislation is not being improved to accommodate them. The persons who are managing or who are still in control of these different disciplines, they don't want them in because now they feel, oh, you're infringing on their territory, money is involved. But sometimes I feel saddened because I said, we as a people still have not matured to realize that, hey, one day I'm going to leave it behind. I must begin to encourage newer persons into the profession, and the kind of training and skill that they have is definitely needed because things are changing and evolving in professions on a daily basis. So if we continue to be small-minded and try to block and stop, then we're not improving as a society.
Right, yeah. And so that's what I mean in terms of the industry itself, or that discipline of eye care in particular. It's really almost wide open for super growth in all aspects, because in disciplines and sub areas and specializing in the different focal points. Because I was going to ask you what in the Bahamas right now is the biggest eye health care issues that we see in terms of the actual person, patient.
Dale, it is so vast now, it's unbelievable. Before COVID, pre-COVID, being a Black nation, the non-communicable diseases, hypertension, diabetes, and those, they impact us greatly, and then it impacts your vision. So we've always had issues and problems with managing patients for that. Okay.
Mm-hmm.
Because, that's our populace, hypertension, diabetes, in the older population and in the younger
Right.
population. Those are some of the medical. Then, of course, you have issues like glaucoma, which is another black man's disease.
Mm.
So it is very prevalent in our country and even across the board. You're seeing more juvenile and younger patients being diagnosed with it. And I think it's because the technology to diagnosis has improved tremendously that we're now picking it up even more and more in younger patients. Okay.
Mm-hmm.
So that's just say kind of three of the medical issues that impact us. And of course, cataracts. That's a big one in the population. On the vision side, basic common vision problems, hyperopia, myopia, astigmatism, convergence problems, muscle imbalance. These are common issues.
What's some of the experiences somebody would have if they have these type of things? Now, I know I have a stigma, so I have an idea what.
Well, if
when that
you
happens, but-
are farsighted, you find these persons have difficulty working up close, and particularly in children. When I did a research paper for the ministry, the national, when they had the national competition several years ago, and my paper was one of the papers they had presented at the conference, because I did the effects of vision on school-age children. And at that time, I was working in public health at the South Beach Clinic, seeing children. And I was noticing that these children were coming in, and one of the main basic problems was farsightedness and astigmatism. Now, what I noticed with these children, that they performed worse in the classroom, short attention span, easily distracted, okay? Don't like to study, don't like to read. Now, a person who is nearsighted, back then or even now, they used to call them nerds. Why? Because these are the students who are the top of the class. They are very focused because they see mainly up close. So they're going to read, they're going to study, they're going to pay attention. They don't pay attention to what's happening away from them because they can't see what's happening out there. So these are students who do better academically because they're more focused. But when a child has farsightedness, constantly causing problems. And I could talk about it because that was me. I thank God that God gave me the ability that even if I didn't study or whatever, I did well. However, I hated studying. When I was sent to music school, I hated having to read the music sheet. I learned to play by ear. I did not know that I had a lot of farsightedness. It wasn't until I became an eye doctor that I realized what my problem was. I was able to start managing myself. But I never complained that I couldn't see. My parents never took me for an eye exam because back then you only take a child to the doctor when the child was complaining. So I never complained. But I knew if I sit down to study, I'm biting my fingernails, looking at the window. My mind just was not there, but I didn't know I had a problem. Right. So those were some of the issues.
Yeah. So no, I was going to ask, just to be clear though, farsightedness mean that you could see close or you can't see far?
Farsighted means you can see far, but you have trouble seeing close. Nearsightedness means you see near, but you can't see far.
Right. Right.
Okay, it's the reverse. And then when you have astigmatism, it affects your vision far off and close up at the same time. Okay.
So that's my excuse for not being able to read when I was in high school? That's a good excuse. I could pass with that.
I don't know, but but when I did this, when I was working there, a lot of these children came in with those issues. And also what I found in the Haitian population, a lot of the children had astigmatism. Okay, so I said this has to be associated with their genetics. You know how Chinese people tend to be more nearsighted?
Right.
Okay, certain populace have certain conditions. And what I found was a lot of the children who were of Haitian descent who came in, their problem was astigmatism. I mean, once they came in and they started talking, I knew right away, this must be. And sure enough, once I checked them, they were showing a lot more astigmatism. So those are the common issues that we find with vision in our population.
And what's the risk to those on our society in terms of even the individual? I mean, how does it impact them? How does
Okay, let
being
me tell
treated?
you what happened post-COVID. Now, when COVID came and we were pushed into lockdown, right? What do you think most of us were doing during that time? We couldn't go nowhere.
Watching TV.
TV? Who watches TV now? Only the older people watch TV.
Yeah, well,
Okay?
some people who don't
Most
have
people
data.
were where?
Yeah.
Right here.
Mobile.
Either the phone or the computer. So think about it. We were locked down at these shorter working distances for hours and hours. People were spending hours and hours. And then a lot of children today now, what do? Play those video games. You know, they're there all the time. Carpal tunnel is the next 21st century disease because everybody just, you know, all day. Adults and all. So over time, if you're locked in at a shorter working distance, meaning where your eyes compared to the screen or monitor that you're using, the muscles begin to weaken because you're keeping them locked at that distance. And then when you have to look away, you know, it takes longer now to readjust. So your focus is now thrown out of whack. And that became a problem. Okay. When we reopened in June of that year, persons who I may have seen in January and February of 2020, they were now coming in saying, Doc, I'm having headaches, my head. And as a result of that, what we found was that they were becoming even more nearsighted, but the nearsightedness wasn't causing the headaches. It was the astigmatism. You're locked in at a shorter distance. So the cornea now is steepening to keep up with what you're doing. And these people were working for hours and hours on end.
Right.
As a result of that, the cornea shape changes and becomes more irregular. And then, of course, that affects vision because when a light hits a surface and it's not equal all around, just like a camera, the image is out of focus. And that is what we saw happening. So we saw a lot of that. Headaches. People were coming in, children who were always in front of the computer, they could work fine. Now they go back to school, they can't see the board anymore, you know, because of that. So nearsightedness. Other major problems.
Before you go, I was going to say that's how I got to know I needed glasses because I could hit the cover off the baseball in the day, but I couldn't hit it in the night, and they couldn't figure out what was happening. And one day in class, I was tired, and I was just halfway leaning on the desk. This is in university now. And so, you know, they don't check. All you going to collect your money. So, and I just happened to look through the water glass, which was on my table. And then I was able to see the board much clearer than what it was without. And so that's how I got to go get checkup. But I mean, by then I was ready to leave school. So
no, most of the children you're finding now, I'm seeing it on a regular basis. Parents are bringing them in because they're saying, "Oh, I can't see the board anymore. I can't see the board." So during the time they were locked down, they were fine working at computers and monitors. But now that they have to go out in the world, and then the distance of the eyeball, the distance now changes. They realize, "Oh, I can't see." So
is there exercises for that to restore it?
No, unfortunately, no. Now I remember this gentleman who used to be telling people, yeah, you do these eye exercises and stop you from wearing glasses and whatever. But I tell them, if these things work, that's what I'd be doing, Dave. Okay? That's where the money would be. I won't be locked down in an office all day seeing patients. I'd be doing that. Or the other thing is carrots. I'd be selling carrots.
I was just going to ask you, do carrots work? I mean, I have that as a question.
You know, I would be selling carrots, but carrots is associated with beta carotene, and that's pigment in the eye. And so back then, I guess people thought, oh, if we eat carrots, then it improves the vision. But you could eat all the carrots you want. You could, however, but carrots don't improve your vision. Okay?
Yeah.
And too much carrots may not be good for the body in general. Some of the other main issues we're finding now, dry eyes. Dry eye is a major problem for everybody because most people say my eyes are burning, eyes are red, the eyes are stinging, the eyes are watering. Dry eye is a major issue that's coming out as a result of post-COVID.
Okay.
Headaches, vision changes, that sort of thing.
And that's because of the close looking at these electronic devices and stuff all the time, or is that
Yes,
for some
because for
other
one,
reason?
we're staring all the time. So when you're staring, you're not blinking sufficiently. So you're not
Right, right.
lubricating the eye. And for most of us, we're either working in AC or the fan is on. So the environment is contributing. So
Right.
I tell a person, you have to pay attention now to your vents, how they're coming at your eyes. And then think about it, children. I tell persons, babies are coming out of the womb swiping now. You know, I see them coming to my office, and what do parents do? They do a phone or
Give them
tablet
the
or
phone
something day,
occupied.
all day, right here, right there. I'm like, oh my word, it's going to increase the business, but it's a detriment. Persons who are
Right.
watching movies on their telephone and watching movies on these smaller devices, that is a greater impact on the visual system, and you're going to see your vision deteriorate and change with time.
Right. Right. That's crazy. So the diseases and the like that is being born out of this new habits that we have and so forth. What specifically are they? I mean, you talked about glaucoma before, but I think they've been around from forever. And what are some of the other ones? Stigmatism and the like. Is it?
Astigmatism, dry eyes, okay? People are becoming more nearsighted now. And so they're actually running research worldwide to see how they could slow down myopia in children in particular and some adults, because we're staring so close at these models. It's causing most of us to become more nearsighted.
And myopia is what?
Yes, myopia. So myopia trials are happening around the world to see how they can slow down the progression of myopia. Those who are nearsighted are becoming more nearsighted. Those who are just borderline are moving into that.
Okay.
Some other issues that we're seeing, muscle movement and eye movement, near point of convergence. Near point of convergence is the point at which both eyes come in together to
Yeah.
keep an object in focus at a very close distance. You find with a lot of these children now, finding that their near point of convergence is receding, moving further out. So when you have that problem, children don't like to study as much because both eyes are not in focus, and therefore they have challenges with reading. Keep in mind also, when we look at a computer screen, any digital device, the amount of pixels involved to keep an image in focus, what do you think the eye has to do? Work even harder to keep an image in focus, and for the length of time that we spend in front of these digital apparatus. So we're seeing the deterioration of vision over time. I keep saying I can't imagine what it's going to be like a decade from now. Now, of course, they're coming up with all sorts of different gadgets and things to say, oh, this is going to
blue screen, this, that,
help and whatever. But I say to persons, if you don't treat the underlying vision problem, the person will continue to have a problem. I'm talking about the blue screens and the blue light. Okay, glasses. Before blue light, what was it? The screens that you put on top of the computer.
Top of right here.
Exactly. Now, if those were the things that worked, why aren't we still using them today? Okay. Now, the next intervention was the blue light. Blue light, which is a good device, was really made to block sunlight.
Right.
The blue hue coming off the rainbow, Richard of York gained a battle in vain. The rainbow, the red, blue, green, yellow, indigo, violet. The blue is the most detrimental in terms of the eyes and vision, because the blue light speeds up cataract formation in the eyes. Therefore, research came up and developed blue light coating that's good for your glasses, because it does help. It blocks sunlight and slows down cataract progression. Well, research guys say, hey, radiation is coming off of computers. Therefore, we need blue light
to block
for the computer. So blue light glasses. And some people swear by these things, a set of them making sure they have a complete eye exam to know your visual status and to know, hey,
Mm-hmm.
will I benefit? You have parents who are going out and buying these, you have adults who are using these in front of computers. But I tell them, you can blue light it, you can pink light it, you can red light it, whatever kind of light. If you don't treat the underlying vision problem, you will always have an issue with your vision. So go and have
Yeah.
an eye exam.
And it sounds like all three of these things need to work in harmony in terms of not just the eye care, but the actual medical care and all the other stuff that go along with it. So, how do we prevent or treat or care for these things in the Bahamas? The world is moving to be highly digital, so we have to find a way to adapt in some which way or form. So, what would be your professional advice as to how to address that so that we don't be all blind soon?
First and foremost, people have to recognize how important vision is. Vision has always been neglected because we could see. We say, "Oh, no, I'm okay. I have 20/20 vision." I hear it all the time. Oh, I have 20/20 vision. Okay, fine, you have 20/20 vision. But until we begin to recognize that eye health care is just as important as every other part of the body, and we use our eyes more on a daily basis than we think. Secondly, of all the senses we have, which one we think we don't want to lose?
Oh, for sure, the eye.
Vision. Why? Because we will be dependent on somebody else for the rest of our lives. Okay. Therefore, I think for us as a country, and you're seeing the improvement, and it's education. The one thing I am big on is education. I said if you educate people, at least they will know what's going on and be able to help themselves. People think eye care is just having to go into the doctor and they're putting up a screen and you call the letters off and, oh, that's an eye exam. That's just a screening. And
Right.
Bahamians need to recognize that. That is not an eye exam. Now, in the past, that is what we did, and we're still doing in schools and around the place, because you need to know what's happening. Now, for all of
Right.
us, for a lot of persons, yes, finance is a problem. But I tell people if most children have a phone or have Nike tennis or whatever, the latest or whatever,
Jordans.
parents, we really need to make it priority that we need to have our children's eyes tested. Therefore, even for our government, at one point we had a vision clinic at South Beach that dealt with children. I don't know who these people were, but they came along, got rid of that.
Oh, gee.
Now have the clinic on Soldier Road that's supposed to be catering to everybody. You try to get an appointment there, you may get one 2 years from now. And then when 2 years show up, you find we have to reschedule you for some other time.
Right.
Until we begin to get serious about vision care in our country, we will continue to have issues and challenges, and we're having them. Bahamians need to realize that an eye exam is not a 10-minute a screener or whatever. An eye exam includes vision and it also includes medical checks. We need to check for glaucoma. We need to check for hypertension, diabetes. We need to check for changes in the back of the eyes. So if you're going to see an eye doctor and they're not doing these basic things on you, they're doing you disservice. And you, as a person or patient, need to expect more and require more. I've seen too many patients who are being misdiagnosed or who are just being told, oh, it's this and that, and then you realize, no, they have a grave problem. This Friday, a young lady came into my office, 15 years of age. This is her first eye exam. Okay, and I sometimes I'm very hard on parents because I'm saying, okay, this child is 15, grade 10, 11, 12. Why have they not had an eye exam? And most parents would say, oh, well, they had a screening, but it's no, it's out of school or whatever. And what I find is a lot of times the screening does not detect everyone unless they know what to ask or what to do. A lot of times we miss students, and it's a disservice. Now, I tell them, you could miss an adult. They're older, they can manage. But when we misdiagnose children, or when children do not get the proper eye care, you can imagine our educational system, right? And then our job systems.
Yeah, no, I was gonna say because I mean it's gonna send the whole pendulum off course, etc. So we're gonna touch into that when we come back and so forth. So you're listening and watching Something to Think About with Dale Happy Knowles, and we're here with Dr. Ebbie Jackson, and we're talking about eyeballing for greatness, because the vision, as she said a couple of minutes ago, is significant for us, and it's something that we can't exercise ourselves back into good vision, and so forth. And so we don't want to lose it the first time. So we'll be right back and dwell into a little bit as to how or what are the effects of when we start to lose our vision and how it impacts our ability to be as great as we can be. We'll be back.
Sammy's Chicken. There's nothing like it.
When you're looking for clothing, you can shop from store to store. But when you need gowns and tuxedos for weddings, proms, or any black tie event, there's only one name to remember: Buttons Bridal and Formal Wear, since 1986. Enjoy gowns and tuxedos for any budget. We'll see you at Buttons Showroom in Cable Beach, Nassau, or visit buttonsformalwear.com. Nobody does formal wear like Buttons.
Scoop, lick, and savor is a smile and memory being made or reminisce. Whether you're at work, out with family on a Sunday, or have friends visiting, flavor will meet expectations in our 32-ounce container for only $10 if you're having a special event as well. Exotic flavors ranging from sour sop to Guinness is definitely worthwhile.
Welcome back to Something to Think About with Dale Happy Knowles, and we're here this evening with Dr. Ebbie Jackson, optometrist, and we're talking about eyeballing for greatness. And before the break, we touched on a lot of the fundamentals for the industry and the profession, and some of the causes, etc. And so now we want to dwell into the impact of what is happening in the Bahamas and why we really need to change our attitude towards eye care and how we've been approaching things as before. Because I think from my perspective, I was told that I would not have, if I had got my issue earlier, my baseball career might have been different. So it might be other people out there in the same way who, if they would do better at treating themselves or taking care of their eye care, then they might be in a better position to be to their maximum potential. So welcome back, Doc. How you doing?
Wonderful, Dale. Always good to be able to educate persons.
Yes, very much so. So tell us, to put it in perspective now, what percentage of our population has eye health impairments? What would you say?
I would want to say more than 50% now. post-COVID.
Oh.
More
And
than
we
50.
live by salt water. People used to say, go in the sea, wash your eye out, and you're good. You know,
Exactly.
kind of
No, post-COVID, the problem was
50%.
more than
Oh.
50% now. Yeah, more than 50%. And a part of the reason is that before COVID, and we weren't as attached to our digital devices as we are now, because schooling, working, we do everything with these things. Persons who were able to get away with it find now that no, they can't. Headache is a major problem in our society today. And most times, sometimes they go to the general practitioners and they tell them, oh, sinus. Everybody in the Bahamas has sinus,
I
And
just want to ask you if
sometimes
they misdiagnose it.
I am saddened by my colleagues in general medicine because, they go with this talk also, sinus. So we're treating sinus, but patients in most cases have underlying vision problems. I say, I wish they would begin to think, and if somebody's complaining of a headache, first thing to rule out, go and have your eyes checked.
Right.
If the eyes and vision is okay, then you need to take it to the next level. But in most cases, persons need to be referred to have an eye exam. I'll tell you an example what happened. A patient of mine has astigmatism. He didn't have much of astigmatism, but the type of astigmatism that he has, that will give you headaches. Okay. So I saw him prescribe glasses. He wore his glasses. Maybe about 2.5 years later, he started having headaches again. Now, this person knew they wore glasses, but it didn't dawn on them. The headaches started. I think they went and saw the dentist. Dentist said everything was fine. Nobody's even thinking vision at this point now. He was referred to his doctor, and the doctor said, okay, we need to do a CT scan because, he's having these headaches and bad headaches.
Right.
So he was scheduled for one, went to the hospital, went into the room to be prepped to have the CT scan done. Thank God his mom was there with him. And he said, doctors were prepping him and then they stepped out and his mom was still hanging around.
Right.
And what they did was they injected the dye to start the test. What happened was he went into anaphylaxis shock.
What?
He was one of those patients who allergy to the type of dye that they were using.
Right.
And he almost died. Okay. Fortunately, his mom was there and she screamed. The doctors came and then, of course, they had to work on him. After doing the scan, they didn't find anything. And so they said to him, well, maybe you should go have your eyes checked. Only to find out that his astigmatism had increased. And therefore, he just needed a different prescription. So I tell persons, if you find you're starting to have underlying headaches, and a lot of times people would say, oh, maybe it's stress, maybe I didn't eat or whatever. No. If you're finding you're having little underlying headaches off and on, consider having your eyes checked. Rule out vision. At least if you rule that out, then okay, maybe it's something else. Then a lot of people who are diagnosed with, everybody has, it's common in women, the headache. What you call it? Forgetting. Bad headaches where they can have illusions. Migraines, right.
Migraines.
Migraines is another one. Oh, I was diagnosed with migraines years ago. Okay, fine. But have your eyes checked. Yeah, have your eyes checked and make sure that it is not a vision problem that's contributing to headaches. Now, aneurysms can cause headaches. Okay, and these are bad severe headaches. So if you're finding serious severe headaches, you got to rule out a possibility of an aneurysm. Therefore, headaches for one. Secondly, we need to be proactive in terms of children now, before they start school. I say to parents, you don't traumatize children too early. If you don't see any problems with them, by the time they turn age 5 or start, sometimes even with preschools, I'm not too concerned unless you as a parent saying something. But definitely by grade 1, have your child's eyes tested and not go to the nurse, look at the chart, call out the letters and think that is an eye exam. It's not. I say to persons, know your visual status, because once you know your visual status, when your child starts school and they begin to progress, then you'll know, well, hey, maybe vision is contributing to this problem. Some children, because of near point of convergence, need glasses just to be able to read or to be able to keep things in focus at near. And with that also, we show them how to do certain eye exercises to try and help improve their near point of convergence, to allow them to be able to function efficiently. Now, that word function is a key word, because many people have 20/20 vision, but still have vision problems. Therefore, I say to them, it's functional vision that's important. Can you sit down and get your work done in a timely fashion without having any sort of distraction or having any kind of challenges that you realize something is wrong? Therefore, that is what's important. Functional vision. Yes, you 20/20, but if you can't sit down and get this work done in a timely manner, be able to get or study or whatever, there could be an underlying problem.
So if we have more than 50% of people have some type of healthcare
Vision problem.
eye issues, then that means that must be affecting our productivity and whether it's a student in school or people on the job, or even the type of jobs that people are selecting that are going to. So is there any studies or any type of things, or anybody?
When no, vision is not high priority. In fact, I did research back then, and I'm saying in my heart and mind, I'm feeling challenged to again write a paper on post-COVID, what we're now seeing and the impact it's having on our society. But I tell you one thing, when students come into my office and I start, and I love dealing with pediatrics, because if you can help a child, then you're going to help the rest of the family. Okay? So when a child comes into my office for an eye exam, I'm observing that child from the time they come in there. I'm watching them and I'm paying attention. And then I ask questions pertaining to the child. And then I ask the parents, you tell me what you've seen with your child. Okay? And once they tell me, you could kind of associate, okay, this is what's happening. Another major problem we're seeing in our country today, Dale, is autism. Okay? Autism. And most times when patients come in, well, parents bring their children, and I'm trained to detect if a child is probably on that spectrum.
Right.
The school that I went to, that is what we specialize in, pediatric optometry, dealing with children with different dysfunctional issues and problems. So when patients come in, they bring their child and you see it. The question is, how do I effectively manage and tell them this is a problem and this is going to be a long-term problem? Because you find a lot of times with behemoths, our precious little children should not come with problems. And nobody wants to hear that their child has some major challenge. In fact, I saw a little girl today and she didn't come for an eye exam. Her mother came. And I wanted to have the conversation so badly, but I said, no, this is not for the child. This is the mother. But you see it in our population. And it affects their function in the school. Now, depending on the level of the scale that they're on, some do well and some don't. So autism is another problem that we're being challenged with and have to diagnose and see how we get help and manage parents. Because I say at the end of the day, our goal is to make sure that your child can be able to function and help themselves as they mature. Because in the event something happens to you or their caregiver, you want to know that they're able to function to the best of their ability.
So when we look at that, then, so how does it affect people's confidence and their communication skills? Because you mentioned, eye contact is a big one, and if people are having challenges with focusing or near, what you call it, the near syndrome, point of convergence syndrome, and their general success, and because we know you put what I call goggles on people early a child, then they don't wear them. They don't wear braces, whatever. So how does all of this impact a child's ability to really succeed or excel to their maximum potential?
We're seeing a lot of it in our schools.
Mm-hmm.
Most times I tell people our Bahamian children are not as they say we're dumb or we're just failing or whatever.
Mm-hmm.
I don't think so. I think the average Bahamian child can do well and function well if they have the tools around them to ensure that they function and do well. But a lot of times, what I'm saying, a lot of these children have underlying vision problems.
Mm-hmm.
So if they've not had an eye exam or they're not having their eyes checked, then you cannot properly diagnose them to say to the parents, listen, this is what's happening. This is what needs to happen to ensure that your child succeeds. If a child has an underlying vision problem other than nearsightedness, it's going to be hard for them to do well in school. Now, focusing and attention is really a necessary tool when you're studying. Even for, when we think about it now, the virtual classroom. And know why it was a big problem, because after a while, so many children with underlying astigmatism, and then they got bored. They just couldn't take looking at that screen and being there for that length of time. And of course, the virtual environment is different from in-person environment, but it is impacting the virtual environment. And for adults who work in these offices and they have to be in front of these machines for extended period of times, what you're seeing, red eyes. Then they're noticing, they're focusing on that. So they're getting tired. And when you get tired, then it affects the entire body and even ergonomics, because we're leaning closer to these things. We're not sitting properly. So it's affecting our posture, back and neck. And we're spiraling into so many different problems. And then carpal tunnel, So it's one thing that's leading to the next. And the entire body is connected. So if the brain has to give more energy to keep the vision functioning, it's going to take it from some other part of the body.
Yeah, especially if you're not getting a full breakfast before you come, then that's even more competition. Yeah. So it sounds like we really have more a policy problem and an attitude problem towards eye health than anything else, because we dismiss it or put it as a third. Because I mean, we have medical is the big money taker, and really and truly you have mental, and then you have dental, and then you have eye. So these things all fall, I guess, far down the spectrum in terms of what people pay attention to. So what kind of policies or what should be caused to be put in place in order to cause more of these things to happen? Whether it's a child has to be eye checked when they come into primary school, or things like that. What would help?
I must say there have been improvements, and I've been one who's been pushing. When I returned home, mandatory vision testing wasn't in a lot of the private schools, for one. The government had nurses on the ground doing it in the public schools. But because of me working in public health, educating and doing research and so on, eventually a lot of private schools started making it mandatory, including vision. And I tell them, you need to change your forms. A vision is not 20/20, okay? You need to know what is the problem, have the doctor sign off, and make recommendations. So the Catholic program really revamped their program, and they're pushing it. The Anglicans coming along. The government is still doing their screening, but a lot of times they miss a lot. However, for a child entering school now, it's a requirement. But what is happening is they're bypassing the system by going to the general practitioner. General practitioner put up the chart, have them read off. If they pass the screening, they figure, okay, they don't have a problem, knowing that, yes, a child can have an underlying problem. You're going to miss a lot of the persons with astigmatism and farsightedness when you do a screening and you send them along thinking they're okay. And these are children who are going to do the worst in school. In most cases, you're only going to pick up a child or person who has nearsightedness because they can't see at a distance. So they will
Right.
fail the screening and they will be sent to have an eye exam. But the people we're missing are the ones with farsightedness and stigmatism, and they're the ones with the problem. These are going to be the children that's going to be very distracted in the classroom. They're going to play around, fool around, waste time, and just flunk out over time if they're not, if you don't try to help them and try to see what the problem is. So I'm saying, I think more needs to be put in place. It needs to become mandatory for every child going to whatever school to have a vision exam. Now, you know how we go? When we're in our country, we don't want to do what we should be doing. But don't let the child go to school in the United States or somewhere else. Then parents will go to the nth degree to make sure those requirements are met. But we don't do what we're supposed to do in our own town. So a lot of people try to bypass the system, but that's fine. At some point, you can end up to the eye doctor because that problem is only going to get progressively worse. And now that we're in the digital age, policies need to be put in place now. We need to recognize that vision is very important. And then for a lot of jobs, they need to provide vision insurance for their employees. If you want your employee to be on a computer more than 5 to 7 hours a day, you cannot think that that is not going to impact them. And so a lot of these banks, their vision insurance should go every 2 years. Come on, man, 2 years? You know, what we're finding now after 6 months, people are having vision problems. If they've seen you 6 months, previous 6 months down the road, they're complaining of headaches or dry eyes, redness, things like that. So they need to ensure that vision becomes a part of healthcare, just like how they do for medical. Vision shouldn't be a bypass or it costs you so much more because of that. No, we need our eyes. And if you don't take care of your employees to that extent, then how do you think it affects productivity? People are going to call in sick or call in because they have a problem. And you notice with the generations now, I mean, the older ones, they will try to come in and work even with a problem. But younger generations, if they have a problem, I'm sorry, I have a problem. Okay. So we need to begin to put policies in place to ensure that vision is a major part of our health plan. Now, a lot of people are asking, is vision on NHI? Please. It's not, and it's not coming anytime soon, I don't think. But what are we using every day? Computers, phones, using our eyes, but that is not a priority. So unless the legislators begin to recognize that this is a priority in our country, we need to help our people be productive citizens. So we need to provide what is needed and necessary. And then, of course, when they went to the eye clinic on Soldier Road, oh my goodness, now to be able to get an eye exam, people with cataracts, 2-3 years down the road. So what are we going to do?
Yeah. So is it that why not on NHI is it the professionals pushing back because of, I guess, costs and not being compensated and all that kind of stuff, or is it that it's not being addressed, not even being considered?
No, that's not being considered. It's not being considered at this point in time. They're still trying to work out the kinks with general medicine.
Okay.
Vision is not, I'm sure they're thinking about it, but they're assuming that because they have an eye health care clinic, and that's supposed to be the NHI of the Bahamas.
Yeah, not
at
good.
this point in time.
Those people in Auckland, Crocodile, and or Grand Key, don't
Oh
come.
no.
Yeah. Well, Doc, it's been real interesting. It's you've dropped a lot of nuggets on the table and give us a lot of things to think about, and hopefully we will get the momentum to get eye health care moving more in our country, because I think it's one of the things that causes us not to be as productive a society as we could be, and so forth. And so we really like to thank you for sharing with us. The hour is going quicker than you really would think it would go. So much more to talk about. But
Well, hopefully what was discussed would begin to open the minds and hearts of Bahamians who were listening, and they would begin to recognize and realize that what I need to be doing to ensure that I function efficiently in terms of my own vision and even with their children. And then, I close by saying the eye is the window to the world. When you go to your medical doctor, what do? Look in the eye. Why? Because that's the only part of the body you can actually see living tissues. And therefore, you can diagnose medical conditions as a result of looking in someone's eyes.
That's what the bright light for?
Yes.
Oh, I thought it was a Man in Black. Oh.
Treat your eyes well.
Yes.
Cool.
But I know I'm supposed to take drops, dry eyes and stuff all the time, and I don't do it all the time. So I have to now remember your show and interview and do it more often. But they cost so much in the store. But anyway, that's another story.
What you're talking about, the drops of medicine costs more anywhere. It's cheaper here in our country than elsewhere, but we have to manage our conditions and do what we can to live healthy, productive lives. That's the key.
Cool. Awesome. Like I said, thank you again. And hopefully we'll share this as much as we can get it around the Bahamas in particular so that people can know that, there's opportunities to provide themselves or put themselves in position to be as great as they can be. Because not being able to see is a serious thing.
Oh, of course.
So thank you kindly. And thank you everybody out there in social media and so forth. Stay safe. Madam Medusa, good evening.
Enjoyed the show? Then subscribe to us for more educational and inspirational content. Ring the bell so you never miss a show. Let's change the narrative 242